Hi, welcome. My name is Tammy Kate, and I am the Communications Director here at University Health Services, otherwise known as the Tang Center. And I'm here today to talk to you a little bit about the services we have, where you can find more information about those services, a little bit about our student health insurance plan, and our immunization requirements for all incoming students. So hopefully after this you get a feel for what programs and services are available and how to get your questions answered if you have additional information that's needed. So this is just a quick picture of our building. We've been on campus for over 100 years providing services. We're a very comprehensive health center here. We have everything except for sort of emergency care and inpatient hospitalization. And for when you come on campus, or if you're on campus, we're located down the corner, sort of across from the rec sports facility is a good marker there. And I always like to start with letting students and parents and supporters know that all students have access to the health services here, regardless of what insurance you have, whether you have our student health insurance or your own insurance. And I'm going to explain a little bit about kind of how that works here. For example, any student, if you have our SHIP, Student Health Insurance Plan, or your own insurance, would still pay a $15 copay to see a primary care physician. Or, for example, $35 copay for urgent care. And so really the big difference is for students that have our student health insurance plan, most fees are covered at 90%, and then with small out-of-pocket copays. And then for students without SHIP, since we don't bill third-party insurance or outside insurance, the students would pay for the services rendered. We can give them an invoice and they can submit that to the insurance company for reimbursement. All students do have access to counseling at the Tang Center, and there's no charge to speak with one of our counselors. So just a little bit about the times we're in and with COVID and how we've adjusted our services. We've remained open since the start of the pandemic, both offering services here, and then we quickly pivoted to offer all of our services available virtually. Either through phone or video appointments. And we're getting great feedback from students and our providers that it's working really well. It's easy to access providers and the care needed. And I think there's a high level of satisfaction too. Just connecting with a quick video appointment, oftentimes things can get done. Another change right now for those students that have our student health insurance plan, there's no referrals needed for medical or mental health care needs until further notice. And so if a student's staying remote and living at home, they can access care within the SHIP network, and we have all that information on our website. We are providing COVID testing and care for students who have symptoms or have been referred from contact tracing, and that testing is provided at no charge. And there's more information on our website all around sort of how we've altered our services to support COVID and support students virtually. So a little bit about what's in the building. We have everything from primary care to specialist counseling, which includes psychologists and psychiatrists, a radiology department, a pharmacy, a laboratory, physical therapy. So as you can see, it's a real comprehensive health center. A little bit about who's in the building. We have meet the staff pages on each of our department website pages. So if you wanted to see what physical therapists we had here or what our primary care doctors, their backgrounds are, or counselors, we have over 250 staff that are made up of nurses, doctors, health educators, social workers. We also have peer-to-peer student health workers and nutrition outreach workers, so there's some interesting ways for students to get involved too. So a little bit about how to access care. Most scheduling is done online through our eTang patient portal, where our appointments are. We can do secure messaging back and forth. There's a lot of self-help and things you can do without needing an appointment. We also have an appointment office that takes phone calls to schedule appointments, and a 24/7 advice nurse as well. Urgent care is drop-in, and then we also have urgent care crisis mental health support, which is being done virtually right now. So a little bit about primary care, very similar to going to the doctor for sort of your main medical concerns. It's a $15 copay, and we book our appointments out So tonight we would be opening appointments for the next day. So it's called a same day model, but it's really the next day. The appointments are all opened up. And then we also have an urgent care clinic. And any student can access our urgent care. You pay $35 when you're here. On campus, we are open on the Saturday and Sunday starting August 22nd. We are asking folks to call the advice nurse first if they're not quite sure what they need to do, and we can help direct if you need to come in or how we can help take care of you remotely. Our counseling and psychological services, CAPS, is another well-used department. We have a lot of providers providing short-term counseling for academic, career, personal issues, helps students with transition, different parts of the semester, different parts of their journey here. And we are available to do groups, workshops. We have a crisis or more urgent support system as well. And it's real easy to get in. You either call and make a phone triage appointment, or you can book appointments through our attain patient portal. Because we serve such a large student body and campus population here, we do offer short-term counseling. And so we would be, if anyone knew they needed, or between the student and the counselor knew they long-term would benefit from long-term counseling, we would help connect you to someone in the community that often see Berkeley students and specialize in college mental health. Again, just attain patient portal has a lot to offer. Things can get done without needing to come in person. And then our after hours care, we do have a 24/7 advice line that's answered. We do teledoc, which are virtual visits too. When we're closed through our insurance carrier, we contract with a company that provides medical and mental health virtual visits. And then the closest hospitals are Kaiser and Sutter. So a little bit about our health insurance requirement. There's a ton of information on our website. Many of you are familiar with this as you needed to look into our insurance versus your own if you've gone through the waiving out period. But the student health insurance is a requirement that all registered students need to have insurance. You can waive out if you have insurance that meets the university's criteria. And you needed to do that. The first deadline was just passed, but the final deadline is August 15th to waive out. So just a few things about the Great Plan benefits. It's a really rich plan, so really low out-of-pocket costs, 90% coverage for in-network services, no charge for counseling, and then outside of the tag, it's $15 with unlimited visits. Free generic prescriptions here, and reduced copays at our Tang pharmacy, things like $10 for eye exams. So there's really low out-of-pocket and no deductibles for services here at the Tang Center. And then, like I said earlier, we've removed the referral requirement right now for accessing care, knowing that a lot of folks are remote right now. So if you have questions about our Berkeley student health insurance plan, we have an insurance office that has insurance specialists that can help answer questions, help coordinate care, help either you or your students navigate how to use the insurance. So I really recommend you reach out to our office. I did want to mention too, we have TB screening immunization requirements. So all students who are incoming or readmitted need to satisfy a TB screening and immunization requirement prior to the start of their first semester. Our current deadline was July 31st. We realize that a lot of folks are remote. And so we are just asking everybody to keep chipping away at those requirements, uploading records, getting any missing vaccines. For any students that are here or coming to campus, we will be offering some clinics where we can help you complete those requirements. And so on our website here, we'll be posting that information. So a little bit about how to learn more. I really recommend you go to our website, uhs.berkeley.edu. This has all the information by each of the departments, how to learn more about our counseling services, a little bit just on how to get care, and a lot of information on the insurance as well. So thank you very much. I hope this was helpful, and please reach out. We're here to help you and your students transition and have a great journey here at Berkeley. Thank you.